Again, in this video, I am discussing a recall communications that is common 2018. The task is that speak to the mother of a 2-year-old as she wants to arrange for her son to be circumcised. So mother wants to be circumcised, 2 years old child. There was no history of problems with his foreskin in terms of infection or UTI, and he had a normal examinations. She was married to an American who had a circumcision when he was a child, and they had read a lot of literature which stated that circumcision reduced UTIs, genital cancers, and was more hygienic. I basically explained that it is not provided on the NHS routinely anymore and talked through the risk and benefit considerations, and that given her son had not had any problems, the risk of this procedure outweighed the benefits. She did ask that if it was possible to have the procedure done privately, and I said yes. I offered her a patient leaflet and offered to speak to her and her husband again at a later date once they had read the information. Seemed to go well. She was a nice lady who took on board everything I said. So circumcision 2 years age child, that is uh, what the scenario that why first we'll ask that why you want to do that, then reassure some drawbacks we tell, alternative we tell, and giving the red flags. As usual, I am starting IRCAP, introducing myself, making a report, telling my agenda, attendance and prior knowledge. So may I know why you are worried? Yes, doctor, it will affect his adult life later on, and I'm really worried. I would like to do it to my child. Then mother want to do that. So I totally understand your feelings, but let me reassure you that this is one of normal variants before the age of 2 years. Mother here foreskin, that's why I want to the circumcisions. So I totally understand your feelings, but let me reassure you this is one of the normal variants before the age of 2 years. By the age of 2 years, it will be improved. If it did not improve, we can use the small some steroid cream. So there is a the child had foreskin. We tell that is a normal variants and conditions. In 2 years of age old, it will go away. If not go away, we apply some steroid cream. No, doctor, I would like to do it. Is there any other concern? No, just worry. It may affect his adult life. I told you. In our case, that is, they heard that from the leaflets that genital cancer prevent, hygienic UTI prevent. I'm telling you, ma'am, it is a normal variant and it will not affect his adult life later on. What is the harm if we do the circumcision, saying with high anger? So mom want to know what is the harm, then we tell that why the drawbacks. Actually, circumcision is considered a surgery and it is have some drawbacks. For example, because he's 2 years age old now, he may need general anesthesia, and this general anesthesia itself has many drawbacks. It may affect his breathing and it can be risky, and also he may suffer from pain. Adding to this, there is a risk of bleeding. Am I clear? So circumcision, it is an why you are not doing, because it is an operations. There are some drawbacks because it needs to be some anesthesia. We are giving general anesthesia, and general anesthesia itself it has drawbacks, especially on breathing, and it's really risky. That's why also some other like pain, in risk of bleeding. These are okay. Added to this, there is a risk of catching bugs. Although he will do to our best to help him and prevent these drawbacks, but still risks are present. So mainly the risk is that general anesthesia and the breathing, that is risky. It may affect this anesthesia. Okay, doctor, but you do it every day for religious reason. Why you are not doing to it to my child? Yes, we do it for religious cause. Even still has the drawbacks. If we are doing that religious, but even still risk we are doing. Why you are not doing this? Because we are Asians. Actually, no. We are treating all our patients equally, regardless their ethnic group, regardless their age, and regardless their religion. We are searching for what is best for your child. So, if she is telling that we are Arab, maybe for that reason, no. We treating all the patients, regardless their ethnic group, their age, their religion. Actually, here we are doing what is best for your child. That is, we are choosing. Doctor, we are covered by insurance. I do not understand why you do not want to do it. I totally understand this, and this is not matter of money at all, ma'am. It is about the best interest of the child. So yeah, that is not about money. It is best interest of the child. Okay, I will not do it. I can go to another hospital to do it. I can understand what you are talking about, but every hospital will do the same because it is what is the best interest for the child. So if he is telling I am going to another hospital, we will tell that I understand that you're concerned, but I'm to tell that every hospital will take the decisions because all we are doing what is best for your child. Okay, I will complain, ma'am. We all are trying the best for your child. First, we'll tell that we all are best doing for your child. Next, will that she's telling, I will complain. then it is, this is, you're totally right. I will guide you through the patient advice and liaison service. Only if there is any, then the red flags we are telling. All the scenario I already told that red flags or warning sign. We will tell that warning sign. Then you seek the medical advice if you face this, like foul smelling odor, greenish discharge, or redness in his private. You should seek medical advice immediately. Again, I am telling the warning sign: foul smelling discharge, then greenish discharge, any redness and swelling, greenish discharge, redness in the private area. So foul smelling odor, greenish discharge, and redness in the private area. Then any other concern, then giving the summary, trusted website, leaflet, support group, these are. So this is all about circumcisions, 2 years old child communications, come on 2018. Thank you very much.